Okay, let's unpack this. Neurosurgery. Wow. I mean, it's a field that just immediately makes you think of intense complexity, right?
Absolutely. It demands just incredible precision. And not just in the operating room, but mastering this huge amount of knowledge, too.
Yeah, the stakes are just incredibly high.
Exactly. You need this total command of, intricate anatomy, physiology, and then you have to apply it all with sharp decision-making, often under serious pressure.
So imagine trying to climb that learning curve. We've got this stack of sources here today, and they're all focused on one specific resource, something designed to help people tackle that exact challenge.
hmm We're doing a deep dive into the descriptions we found for a book called 100 Questions and Answers in Neurosurgery by Dr. Atef Ahmed.
Right. So our mission basically is to figure out what these sources tell us about this book, but also, maybe more interestingly, what can we learn about neurosurgery itself just from how they describe this guide?
Yeah, it's like getting a sneak peek into the field's demands just by looking at the map they're offering.
Yeah. Exactly, a map to navigate this really complex area.
And it's quite revealing, actually. Looking at how an educational resource is described, how it's marketed almost, tells you a lot about the field's core needs. What are the tough parts for learners?
Right. It highlights the problems by showing you the proposed solution.
Precisely.
Okay, so straight from these descriptions, they frame this book as an essential guide. It's apparently expertly designed, they say, to bridge that gap between theory and practice.
That gap, yeah, that's always the tricky part in medicine, isn't it?
Totally. And they specify it's for medical students, residents, but also anyone just really interested in the field.
And that bridging the gap phrase is key. The sources talk about comprehensive coverage, everything from basic neuroanatomy.
Which is already incredibly dense.
Oh, yeah. The brain, the spinal cord, all the connections, right through to descriptions of complex surgical techniques. What does that huge range tell you?
Well, it says the learning isn't just memorizing parts, right? It's about what you actually do with that knowledge in real situations.
Right.
The sources mention the author, Dr.Atef Ahmed. They call him a renowned medical educator with years of clinical experience and teaching expertise. They really stress this clinical background.
And why do you think they stress that?
Well, it seems to be tied to making the content both academically rigorous and clinically relevant. That phrase comes up. It suggests that, real-world grounding is vital.
Makes sense. Relevance is everything. The sources mention an enhanced learning experience, too. Questions designed to challenge and engage, paired with explanations that apparently go beyond the textbook.
Go beyond the textbook, so deeper understanding, not just facts.
That's what it implies. Moving past rote learning towards genuine comprehension.
Okay, now this is interesting. The format they describe, it's a question and answer format, Q&A.
Right.
And they say it's deliberately designed to be accessible, an easy, digestible read, good for quick study or, more in-depth revision. The desk was probably important when the subject matter is so heavy.
Yeah.
Definitely. They specify 100 in-depth questions. And these questions are apparently chosen to mirror the complexity and breadth of real-world neurosurgical scenarios.
Okay, so why the big emphasis on the format and this mirroring of real scenarios? What's the thinking there based on the sources?
Well, my read is, given how much information there is in neurosurgery, this accessible, digestible Q&A format is probably tackling information overload. That's a huge issue.
Makes sense, breaking it down.
Yeah. And the mirroring real-world scenarios part, that sounds like it's addressing the challenge of applying knowledge, taking it from the page to the patient, conceptually at least.
Bridging that gap again.
Exactly. The sources also say each answer gives a comprehensive explanation, offering context, insights, and a deeper grasp. Plus, it's up to date, reflects the latest advancements.
And that's crucial. Neurosurgery changes so fast. Staying current isn't just nice to have, it's fundamental.
Absolutely.
The sources also mention practical tips and pearls, shared by the author. Things to prepare students and surgeons for the challenges and the nuances of practice.
Nuances, I like that. It suggests it's not just about the big standard procedures, but those subtle things you only learn through experience, right?
Right. Those little bits of wisdom that make a real difference. It implies mastering the field is about more than just the textbook techniques.
So if we sum up how the sources paint this picture, it's not just a reference book, not just a list of facts.
No, it seems positioned as more of a structured tool, something to actively engage you.
Yeah, giving context, offering insights from experience, keeping you current, and all in a user-friendly Q&A way.
The sources actually call it more than a book. They say it's a journey into the heart of neurosurgery, guided by one of the field's seasoned experts.
A journey. That's quite a description. It suggests, a guided path through this landscape that otherwise seems pretty overwhelming.
hmm And it feels like, based on these descriptions, the format and the specific content are deliberately chosen to make that journey feel, well, manageable, navigable.
Okay, so let's bring this back around for you listening. What our deep dive into these source descriptions shows is that this book, 100 Questions and Answers in Neurosurgery, is presented as a really comprehensive, carefully put together resource.
Yeah, according to the sources, its main goal is bridging that critical gap between learning the theory and actually applying it in neurosurgery.
And its value, as described by the sources, seems to lie in a few key things. That accessible Q&A format,
Built around challenging, real-world type questions.
covering a huge range, from basic anatomy right up to complex techniques.
With detailed explanations aimed at really deepening your understanding, not just surface-level recall.
Making sure the information is current, which is vital.
And including those practical tips, those pearls, from clinical experience.
And as the sources clearly state, it's aimed at medical students, residents, or really anyone interested in getting a handle on this demanding field.
So this guide really highlights how a structured resource like this tries to make the massive world of neurosurgery feel a bit less intimidating, maybe more manageable for someone learning.
Right. You should now have a much clearer sense of what this particular guide offers based purely on how the sources describe it and what that description implies about the field itself.
So let's think about that phrase the sources used, a journey into the heart of neurosurgery. Considering everything we've seen mentioned in these descriptions, the sheer scope, from basic science to complex surgery, managing complications, patient recovery, what did that tell you about the nature of such a journey? What kind of dedication, what level of continuous learning does a field like neurosurgery seem to demand based on how this resource maps it out? What path are they really laying out here?